Good afternoon, everyone. Welcome to Apollo Hospital Bangalore Facebook Live. Today's topic will be myths and facts of pediatric vaccinations during COVID-19. I would like to introduce Dr. Radha Kirshna, Senior Consultant Pediatrician, will be discussing on this topic. Please watch the session, and if you have any questions, please share it in comments box below. Over to you, doctor.
Yeah, thank you. I know my anchor has introduced me already. I would like to introduce myself once again. I am Dr. Radha Hegde, Pediatric Consultant, Apollo Hospital, Bangalore. And today I am here to discuss about the facts and myths of vaccination, especially pediatric vaccination during this COVID-19 outbreak. I know this phase is extremely critical. The whole planet is going through a stressful period. It's been a challenging time due to COVID-19 infections. There's a rampant distribution of COVID-19 infection all over the world, and it's been really a challenging time. In the process of these challenges, what we face every day in terms of fear, threat of us getting infected with COVID-19, we seem to be forgetting about the preventive aspects of some of our health care. And one such preventive measure is vaccination, which is the cornerstone in preventing diseases which can be really tackled with vaccination. So this is one thing which I think is extremely important at this time. Now, with the effort to reduce transmission of COVID-19, such as staying at home or work from home, have led to decreased use of routine preventive medical services, including immunization. Now, it is extremely important during COVID-19 pandemic to protect children from vaccine-preventable diseases. Now, as you know, we have vaccines which have been there for ages, I would say more than 5 decades, and vaccines have done wonderful things to our community and to the nation or to the world by itself. And just to prove you that vaccines have done wonderful things to us is you should know that we don't have a single case of smallpox in this world. And what has made that change? So it's just that we have eliminated smallpox by vaccination towards smallpox, and it's a milestone by itself to say that vaccines are helpful to prevent diseases. So one such thing is smallpox. Secondly, we are in the process of eliminating polio in the world. Near elimination of polio is happening. India is already a polio-free country for the last 3 to 4 years, I'm sorry. And yet we still practice giving pulse polio program, which is the cornerstone of trying to eliminate polio in the country. And we still practice not because we are, you may question when we are polio free, why we should practice pulse polio program. We are practicing because one is to continue the surveillance part of it and to make sure that there's no polio in the country. And the second thing is that we could always have a chance of getting the polio back into our country because our neighbors are not yet polio free. So that's one of the reasons why we continue the pulse polio program. Now, these two milestones of eliminating polio and eliminating smallpox is something which we should believe in, that vaccinations can prevent killer diseases. So hence we have vaccinations against, today we have not less than 15 vaccinations which can prevent vaccine preventable diseases. Some of them are the polio for against tuberculosis, and then we have against diphtheria, vaccination against tetanus, pertussis or whooping cough, commonly known as whooping cough, and we have vaccines against chickenpox, typhoid, the common jaundice which comes through eating or drinking contaminated food and water. And then we have vaccines against measles, which is a killer disease, mumps, rubella, and then we have vaccines against pneumonia, the pneumococcal vaccines, against meningitis, the meningococcal vaccine, the Haemophilus influenza vaccine. All this are there in the market. And lastly, we also shouldn't forget that we also give protection against HPV vaccine for the girls about 10 years of age. till 45 years. That's for the girls and the mothers. So lot of work has gone into this vaccine manufacturing against vaccine preventable disease. So in COVID times, there are a lot of myths about not getting out of home or trying to postpone a vaccine. Now, this is something which is can be debatable, but then I think when you start debating, there's no end to debate about this question about whether you should come out of home and get the vaccination done. And if you ask me, yes, there have been a lot of studies or a lot of inputs from literature which says during a stressful period like a pandemic or an epidemic, and if you try and postpone vaccines, and there is this resurgence of those diseases during those times. Now, it's been said that measles is one of the killer diseases. It can really kill a child, especially less than 1 year of age. One of the highest mortality is seen when you don't prevent measles. So it's very important to get vaccines like measles. And now that we are going into a time when it's a winter period, and then flu vaccines, the influenza is one of the other killer diseases. Now, if you look at the fatality rate or the mortality rate of these disorders versus the COVID fatality rate is just about 3 to 5%. That means every 3 or 5 out of 100 people affected with COVID can die, sort of thing. Whereas the fatality rates among with measles or influenza is much, much, much higher than this thing. So it's very important that the vaccinations should be taken during this time. More so with COVID-19 infection, what we have learned a lot of things with COVID-19 infection. One of the things which we have really learned is, I'm sure all of you are looking forward how to tackle this COVID-19 infections. Till date, there is no appropriate therapy for COVID-19. There's no proved therapy for COVID-19. So most of them are on terms of experiences and literature that we are treating COVID-19 infections. The only thing everybody's been talking about, when is the vaccine going to come? The importance is today that COVID-19 vaccine, you are awaiting a COVID-19 vaccine. And it's easier to really question people about COVID-19 vaccines, but there's a lot of research and a lot of things going on in the production of COVID-19. Though it's not right on my part to say when it would be there and when it would be, because it's not easy to produce a vaccine. It has to go through safety measures, trials, clinical trials, phase 3 trials, and then come into the market only when it is safe. So it may take some time, maybe 6 months, maybe 1 year down the line. So it's important for us to say that vaccines prevent a lot of diseases, and vaccination during this time is extremely important, and it is important to take on time these vaccines. So there may be sometimes you may think that I will try and postpone the vaccine. No, it's not a good idea to postpone a vaccine. If your doctor has given you a time when you have to come for the vaccine, it's good to come out and take the time during that time and please finish off with the vaccine. So since I'm actually, I think I'm talking to the more of a lay public sort of thing. So I just wanted you to know a few facts about vaccination. There are a lot of people who would believe that vaccine would do good for their child and even for the adults, but there are equal number of people who will always think that vaccination could be bad for them, or it's just that they're scared to come for vaccination. Now, vaccinations have been happening for more than 5 decades, and if you look at the vaccine preventable diseases rates, you'll see that every year or every decade there's a decrease in a lot of these disorders which can be prevented with vaccines. Now, what exactly do you mean by vaccinations? What are vaccines? Now, vaccines are just nothing but products that are given in childhood to protect against serious or deadly diseases. Now, this is what I mean by vaccine. And the process of giving a vaccine to protect this child against deadly disease is what is called as vaccination. So this is how you define a vaccine and the vaccination. Now, some of you may find, how does this vaccine work? Now, Vaccines can work in two different ways. One is a direct effect, and then you have an indirect effect, or what is termed as an herd immunity. A lot of you people may be learning or trying to know what exactly is herd immunity, because with COVID situation, herd immunity is one thing. A lot of countries have been trying to see if they could get herd immunity. Now, let's try and explain what this herd immunity is. Herd immunity is trying to get yourself exposed to the the bacteria or the virus which is prevailing during that time. So it's like saying that if 100 of us get exposed to the thing, and if there's 80% of them who are in a younger age group who have a good immune system, right? There's a chance that you may get protected. Not that all 80 will get protected. The risk of losing a lot of them in herd immunity is quite high. But then especially the vulnerable age group like very very young children and the extremes of age above 60 65 years of age, there's a chance that you may lose a lot of individuals during this process of herd immunity. So it's not a well tried and tested phenomena to really get into this herd immunity process. Through vaccines also you can get herd immunity. So one of the other way of trying to get herd immunity or the indirect effect of a vaccine is trying to vaccinate all of them during this thing. So if you take 100, a population of 100, and you vaccinate 80 of them at least for that disease, then the rest 20 will not be exposed to the vaccination because the group is much smaller and this vaccinated group is very huge. So there's no transmission of the virus or the bacteria for the rest of the 20. So still you could lose a few of them in that 20, but still a vaccine-induced herd immunity is better than a natural herd immunity at any point of time. I mean, that's debatable again. So that is one of the ways of the thing. Now, when you say direct effect of a vaccine, now what do we give when we say when I want to vaccinate your child? For example, I want your child to be protected for typhoid. Now, what does this typhoid vaccine have? This typhoid vaccine has a dead attenuated bacteria of typhoid in the vaccination, which has been cultured or produced in the lab media. So it's been tested before it comes into the market or before the patient receives it. It's been tested in different phases, phase 1, phase 2, phase 3 trials, found about the safety and the efficacy of the vaccine, and then it comes into the market. So when me or my other colleagues or pediatricians introduce this vaccine to your child, the moment I give you the vaccination, when I give the vaccination to your child, after a lag period, this vaccine will act on your body and your immune system will recognize that there's a foreign object which has been introduced into your body, immediately starts producing antibodies against this vaccine. You got it. Now you have ready-made antibodies in your body for a typhoid infection. So the next time when you have a typhoid infection, a natural typhoid infection, you have already ready-made antibodies protecting you. So this is the basic mode of action of vaccination, which is also called as the direct effect. The herd immunity is an indirect effect of vaccination. Now, some of you may be wondering whether vaccines are safe. Definitely, vaccines are really, really safe. In today's era, with so much of advances in science, vaccines are much, much safer than when I talked about 4 or 5 decades ago. The only few things what your child would probably get is a mild fever or a little bit of pain in the vaccination site. Other than that, there are no serious side effects of vaccinations. 1 in a million can develop some serious side effects, but then look at the benefit versus the risk ratio, and the benefits are much more than the risk of taking a vaccination or trying to be away from vaccination. So I think it's good to vaccinate, and vaccines are definitely very safe. So sometimes uh, there is, and this thing, there's a question why I should vaccinate my child, and the last 5 decades have the answer to that, and the 5 decades have seen that the vaccination all over the world and effective vaccination, there's a lot of control of these diseases, lot of control, and some of the diseases have been eliminated in the world, like I said, the smallpox and the polio, and so are tetanus, so are diphtheria, so are pertussis. But then I think the surveillance is extremely important. Just because you're eliminated, it doesn't mean that you don't vaccinate or you try to postpone vaccination. It's not a good idea of postponing vaccination, because just that lag period or the gap of postponing the vaccine, there's always a chance that you may have the disease or the surge of disease which is there. So its vaccine saves lives. Measles vaccine alone is estimated to have prevented 23 million deaths between 2000 and 2018. So imagine 23 million deaths have been prevented by just vaccinating. And that's an answer for vaccination, that it prevents major diseases. So that is what it is. And some of you may even question, can my child handle all these vaccines? Yes, they can handle. Though now we give combined vaccinations, which are 6 vaccinations in one shot. It's a good thing to get combined vaccinations. Prior to this, we used to give 3, 3, 4 vaccinations, and now it's been simplified to make 6 vaccines in one shot. Your child will be able to handle that. The immune process of the immune load will be as good as taking individual vaccines versus combined vaccines. So it's very important that you take the vaccination on time. And now, as I said, what diseases do vaccines prevent? We have vaccines now against polio. We have vaccines against diphtheria, tetanus, pertussis, measles, hepatitis B, hepatitis A, typhoid, and then we have against rubella, and then we have against chickenpox, and so on, like Haemophilus influenza, pneumococci to prevent pneumonias. And when I talk about pneumococci and influenza vaccines, especially during winter, especially these 2 vaccines, the pneumococci and the influenza vaccine, are not only for children, it's for adults, especially the vulnerable adults beyond 65 age group, especially those who are suffering from chronic diseases like chronic lung disease, chronic renal failures, immunocompromised patients. I think we need to stress on them getting prevented with pneumococcal vaccines as well as the influenza vaccine. Influenza vaccine is something which you should look forward for in this winter season, because the fatality rate of influenza vaccines, though we don't have good Indian studies about it, but the studies done in more advanced countries, they tend to lose a lot more patients during influenza season than even COVID pandemic. So it's important for adults to take vaccines during this time. Now, there's a lot of reservation about how do I make an appointment during this COVID season for vaccination. I think all hospitals have been geared up for tackling these type of disorders. So it is good to stagger and give vaccinations. It's good to try and see that your appointments are staggered instead of seeing all of them at on a given day. So it's just a vaccination day where you could come into the vaccination. Even on that day, we could try and reduce the volume of patients coming into the hospital. And from your end, how safe are you going to think? Yes, hospitals are taking a lot of preventive measures by screening you before you get into the hospital, in terms of temperature screening and trying to make sure that you enter the hospital without any infection. And we're trying to make sure that we try to keep distance between patients, so maintaining distance. So from your end, it's important that you come up with masks and wear your masks and come into the hospital, take an appropriate appointment and come. Keep your hands clean by sterilizing your hands with sanitizers. Carry your own sanitizer if possible. Maintain distance between each one of you, sort of thing, and try and avoid people coughing and sneezing or things. So these are some of the things what you'll have to take care when you walk into the hospital. So hospital is a very conducive environment for vaccination and for other disorders, because you're screened. You're not just let into the hospital just like that. And when you're screened, obviously you don't allow people with infections getting into the hospital. So this is what I would like to tell today about my talk. If there's any other questions, yeah, I look forward for it. Thank you.
Thank you, sir. We have a question from Mrs. Lakshmi.
Hmm.
What are the ways to help my child feel better after getting a vaccination shot?
Yeah, like I said, that most vaccines today are very safe. If at all you do get some problems in the vaccination, it's just a mild temperature, right? Or it could have some local irritation in that area where the vaccination has been given. So if your pediatrician or whoever gives you the vaccination would always talk about this before you get out of his chamber. We'll always provide you with some paracetamol drops or syrup based on the weight of the baby. And if there is some amount of pain or tenderness, this paracetamol drops also helps for that, as well as some cold fermentation, or some of them also use hot fermentation on that area, which comforts the child. And max to max, these mild irritations and fever will last not more than 24-48 hours. So I think that that's the way to, and its comfort is based on how you would tackle it at your level.
Thank you, sir. One more question from Mr. Hari. What happens if my child is not fully vaccinated before school?
Yeah, I said in my talk that it's good to take vaccinations to prevent vaccine preventable diseases. So if you are lax about that, there's always a chance that your child could get one of these diseases. And then the disease burden is much more than the vaccination. So it's always good to prevent. So obviously, when you have a vaccine to prevent a major disease, it's good to take it on time rather than taking it later or not trying to take it at all.
Thank you, sir.
Thank you.
Thank you. Thank you, audience. If you have any further questions, please drop in comment section. Thank you.